important to note that if not treated properly, hypoglycemia caused by injection the incorrect amount of insulin can lead to fainting, seizures, and even death. Insulin is an hormone made by the pancreas that allows your body to use sugar in the food that you eat for energy or to store glucose for the future use. Insulin helps keep your blood sugar level from getting too high or too low. People with type 1 diabetes mellitus cannot make insulin because beta cells of their pancreas are damaged or destroyed. Therefore, these people will need insulin injection to allow their bodies to process glucose and avoid complications from hyperglycemia. These are the steps on how to administer insulin. The first step is decide where to give the injection and know how to give the injection. It's very important to note that insulin should be given at room temperature. Gather additional supplies such as syringes, alcohol wipes, the medication, gloves, and hard container for disposal. It's very important wash hands with soap and water and dry them well. We are not doing that during this process, but it's very important to keep in mind the wash hand with soap and water. Check the insulin bottle, make sure that is the correct dose, that the medication not is expired, that is the correct medication. Now, we are going to represent how to do the correct process. Using the glove, we are taking the insulin bottle. We have to wipe the top of the bottle with an alcohol wipe and let it dry. Take the cap off of the needle, pull back the plunger of the syringe to put as much air in the syringe as the dose do you want to use of the medication. Put the needle install and throw the rubber top of the insulin bottle. Push the plunger so the air goes into the bottle and turn the bottle upside down. Pull back the plunger and get the right dose of insulin. Pull back the plunger. Be sure that there are no bubbles inside the bottle. Take the syringe out and put the syringe down carefully. Now you have to choose where to give the injection, such as arm or abdomen. In this case, we are using the one lemon. So the site for injection that you should have to be clean and dry. Pinch the skin and push the needle in a 45-degree angle. Push the needle all the way into the skin. Inject the insulin slow until it is all in. Leave the syringe in place for 5 seconds after injection. Put the needle out, put the syringe down, and press the side for a few seconds after the injection. Don't recap the needle and place the syringe in the hard container for disposal. So, summarizing, we have to keep in mind some important topics. First of them, it's very important the wash hand process to avoid complications related with infection. It's very important check the insulin, that the medication is expired, that the dose is correct. It's very important select the site for injection, and this site has to be clean and dry. It's very important to put the syringes and needle in hard container for disposal. In this step are followed, then there will be no issues and insulin level will maintain regulated. This will keep the individual healthy and free of hypoglycemia.